Hi, everybody. Today, the topic is how to be realistic about a parent or a spouse's health, or even your health if you are that person who needs care. I'm Pamela D Wilson. My website is PamelaDWilson.com. On there are a lot of hope, help, support, education for caregivers and aging adults. Please like and share this video with other people that you know. Follow me on my YouTube channel so that other people can find help about caregiving and aging issues. So, as a caregiver, being realistic about a parent's diagnosis can be a very emotional topic. As the person who needs care, being realistic about your health diagnosis can be challenging. It can be a subject that is unpleasant because it's difficult to accept reality sometimes. But the benefit of doing that is you can make a plan. You can change things so that your daily care or your care situation can improve, or you can at least maintain it. And if that's not possible, you can make a plan for the care that you want. Thinking about death, mortality, the mortality of ourselves or loved ones can bring about a lot of mixed emotions. And many of us are rarely in a position or a state where we're comfortable talking about this, or we're ready to face the fact that a parent could die or a spouse could die, or our life may be ending because of a diagnosis of cancer or something else. It also includes having discussions about what do we want for care? If we're the person who's diagnosed, do we want extensive treatment? Do we want chemotherapy? Do we want radiation? Who's going to care for us? How is that care going to be provided? So the idea of being realistic about care really can be emotionally challenging, but it has a lot of value. So if you are a caregiver in a family, you know that there's usually one person who becomes a caregiver for a parent or a spouse. Now, if it's a married couple, it's usually mom or dad, and behind that, it's a child, an adult child, usually a daughter. So it's very important to have discussions about who's available to be a caregiver, for what length of time, and what you can do. Now, if you're that spousal caregiver, it's also important to have discussions about what happens when your spouse dies. How will you go on living? How will you take care of yourself? And even more important, how will you take care of yourself when you are that caregiver? Because if something happens to you and you don't have children, who's going to care for your spouse? Or if something happens to you and you do have children, can your children step in and do that? So there's a lot of guilt that enters the caregiving situation when we talk about, I feel like I have this responsibility and duty, but what can I really do as a caregiver? How much time can I commit? So a way to start thinking about this is to ask yourself, how many hours a week with your current life situation can you commit to caring for a spouse or a parent? And if you're going to give things up, what exactly are you going to give up? Are you going to give up going to college, finishing a degree? Are you going to give up a career, future income? Are you going to not get married or delay getting married? Or if you are married, not spend as much time with your spouse? How will that affect your marriage? If you have children, are you going to trade time that you would spend with your children for an elderly parent? There are a lot of trade-offs in caregiving situations that we have to think about. And these can really have negative consequences on our life. So while adult children want to be helpful, being very realistic about a parent's health and the care that they need in the future can lead to very practical and balanced discussions today so that you can avoid unrealistic expectations and sacrifices and make a plan. It's so important to talk about caregiving before care needs increase in time, in complexity, in medical conditions, so that families can talk about them in a more realistic, practical, less emotional manner. It's very hard to have these discussions when a parent is in the hospital or in a nursing home and emotions are high and you're trying to figure out what to do and you feel time pressured and there's a lot of crisis and emotion happening. That's much more difficult. It's also important to talk to doctors and medical providers about a parent's health condition and what it looks like today, what it looks like tomorrow, what the complications are. And it's okay to say, how long does a person with this type of condition last? What can we do to make it better? What can we do to manage it? How can we avoid other health complications coming behind this? Those are questions many times that family caregivers and adults don't know to ask. It's important to know what questions to ask. It's important to know what to plan for. If you're that caregiver, make sure that you're attending medical appointments and asking all of the very, very important questions so that you can be realistic and make a plan for a future. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there is a lot of hope, help, support, education for caregivers and aging adults. Please share this video with other people that you know who are looking for hope, help, and support. Thanks for being here. I'll see you all again soon in another video.